Have you ever caught yourself wondering, is it actually possible to increase penis size safely? Have you ever looked down in confusion because your urine suddenly sprayed in two different directions? Or maybe you've experienced something even more frustrating. Everything feels fine until you begin overthinking, and then your erection disappears almost instantly. If any of those questions sound familiar, I want you to know something right away. You are far from alone. These are some of the most common concerns men bring into my office. Yet they're also among the least discussed because embarrassment keeps so many people silent. I'm Dr. Rena, a urologist who has spent the last 6 years helping men improve their health and confidence. Today, we're going to answer these questions honestly using medical science instead of internet myths. Unfortunately, the online world is packed with misleading advice, unrealistic expectations, and clever marketing designed to make men doubt themselves so they will buy products they don't need. My goal is very different. I want to replace confusion with facts, fear with understanding, and shame with confidence. Throughout this video, we'll look closely at why psychological erectile dysfunction, losing an erection because your mind gets trapped in worry, is so common, especially among younger men, and more importantly, how it can be reversed. We'll also talk about whether adult film performers are naturally much larger than average or whether there is much more happening behind the camera than most people realize. Finally, we'll explain why urine sometimes sprays or splits into different directions, when it's completely harmless and when it's your body's way of asking for medical attention. By the end of this discussion, you'll leave with more than simple answers. You'll have practical steps you can use to protect your health, strengthen your confidence, and feel much more at ease. Before we begin, I'd love to know where you're watching from. Leave your country or city in the comments because it's always encouraging to see this community growing across the world. And if you appreciate straightforward, evidence-based conversations about men's health, take a second to like this video and subscribe. Every week, we discuss important topics openly, honestly, and without judgment, always keeping your long-term health and quality of life as the priority. Before we dive into today's questions, there are 3 major myths we need to clear up because these misunderstandings cause unnecessary stress for countless men every single day. The first myth says that if you lose your erection during sex, it means something is permanently wrong with you. The truth is that in many cases, your body is working perfectly well. What often gets in the way is anxiety. When your mind becomes overwhelmed by pressure and self-doubt, it interrupts the natural process that allows an erection to happen. The encouraging news is that this kind of erectile difficulty is usually reversible. The second myth tells men that adult film performers prove everyone else is too small. The reality couldn't be more different. What you see on screen is influenced by rare genetics, careful casting, camera angles, lighting techniques, and sometimes medical assistance that viewers never see. Adult entertainment is designed to create fantasy, not to represent everyday life. The third myth suggests that a urine stream that sprays or splits automatically means something is seriously wrong. In reality, many cases are temporary and completely harmless. However, there are situations where changes in your urine stream can signal that your prostate or urethra deserves medical attention. Instead of responding with fear or embarrassment, it's much healthier to respond with knowledge. Once you understand what's happening inside your body, confidence naturally begins to replace uncertainty. For those joining this channel for the first time, let me properly introduce myself. I'm Dr. Rose, and for the past 6 years, my work has focused exclusively on men's health and urology. During that time, I've spoken with thousands of men who sat across from me feeling nervous, frustrated, or even ashamed to ask questions that had been bothering them for years. Almost every appointment begins the same way. A patient hesitates, lowers his voice, and wonders if he's the only one dealing with the problem. My answer is almost always identical. You're not alone, you're not abnormal. And the concern you're experiencing usually has a very real biological explanation. In many situations, it also has an effective solution. That's exactly why we're going to examine the 3 questions I hear most often. so you can understand not only what's happening inside your body, but also what practical steps you can begin taking today to improve your health and restore your peace of mind. The first question we need to discuss is one that I hear constantly from men in their 20s, 30s, and even 40s. Why do I lose my erection when I start overthinking? This is a question that often carries a lot of frustration because many men assume their body has suddenly stopped working. But the reality is much more complex, and understanding the connection between your mind and your body is the first step towards solving the problem. From a biological perspective, an erection is not just a physical reaction. It is a carefully coordinated process involving your brain, nervous system, blood vessels, and hormones. All of these systems need to work together at the right moment. When you feel relaxed, comfortable, and sexually stimulated, your brain sends signals through your nerves that tell the blood vessels inside the penis to relax and expand. This allows more blood to enter, creating the firmness needed for an erection. It's a natural process that your body is designed to perform. However, the situation changes when anxiety enters the picture. When you begin analyzing every moment, asking yourself questions like, am I performing well? What if I lose it? Or, is my partner noticing something? Your brain can shift away from pleasure and into a state of stress. Your body starts preparing for danger instead of intimacy. Stress hormones, especially adrenaline, begin increasing. These hormones can tighten blood vessels, interrupt normal blood flow, and interfere with the communication between your brain and your sexual response system. This is why many men experience something incredibly confusing. They can have normal erections during sleep while waking up or when they are alone, but struggle during sexual situations with a partner. The issue is not always a physical failure. Sometimes the biggest obstacle is the pressure created inside the mind. The emotional side of this problem can become even more challenging because of how quickly the cycle develops. Imagine a man experiencing this for the first time. Maybe he loses his erection once during intimacy. At that moment, he feels surprised and embarrassed, but he assumes it was just a random event. Then the next time he becomes worried that it might happen again instead of focusing on connection and enjoyment. Part of his brain is constantly checking, monitoring, and judging his performance. That fear itself creates more stress, and the increased stress makes another erection problem more likely. Eventually, the original problem is no longer just the first experience. The real problem becomes the fear of repeating it. This creates a frustrating cycle where anxiety causes the exact outcome the person is trying to avoid. Over time, this can affect confidence, relationships, emotional connection, and overall quality of life. But here is the important message I want every man watching this to understand. Psychological erectile dysfunction is real, but it is also highly treatable. The first step is always making sure there isn't an underlying medical reason causing the symptoms. Many younger men assume erectile problems can only happen because of stress, but that is not always true. Even in men under the age of 40, a percentage of erectile dysfunction cases are connected to physical health issues. Your erection depends heavily on healthy blood vessels. And this is one reason doctors take erectile changes seriously. The arteries that supply blood to the penis are smaller than many of the arteries in your heart. Because of this, changes in blood flow can sometimes appear in sexual function before other symptoms become obvious. In some cases, erection difficulties may be an early sign of cardiovascular problems, high blood pressure, diabetes, or other conditions affecting circulation. That is why the first recommendation is simple: get evaluated. A proper medical checkup can help determine whether the cause is physical, psychological, or a combination of both. Once serious medical causes are ruled out, the focus can shift toward breaking the anxiety cycle and rebuilding confidence. One helpful approach is working with a professional who understands sexual health and performance anxiety. A therapist trained in this area can help you identify the thoughts and fears that are creating pressure and teach you strategies to regain control. Many men discover that the problem was not a lack of ability, but the overwhelming expectations they placed on themselves. Another important step is changing the way approach intimacy. Many couples unintentionally create pressure by making penetration and maintaining an erection the only measure of success. But intimacy is much broader than that. Touch, emotional connection, communication, and enjoying the experience without constantly judging performance can help reduce anxiety and allow your natural response to return. In some situations, doctors may also recommend temporary medical support. Medications such as tadalafil can sometimes be prescribed to help men maintain erections while they rebuild confidence. These medications do not create sexual desire, and they do not work without stimulation. Their purpose is to support the physical process and help interrupt the cycle of fear and disappointment. For some men, simply knowing that their body has support can remove a significant amount of pressure. As confidence improves, anxiety decreases, and the natural sexual response often becomes stronger again. So if you have experienced losing an erection because your thoughts became overwhelming, remember this: you are not alone and you are not permanently damaged. Your brain and your body are connected, and sometimes your mind can create barriers that feel physical. The good news is that these barriers can often be removed with the right understanding, the right support, and the right approach. Now let's move to another question that many men secretly worry about but rarely ask openly. Are adult film performers naturally that large, or is there more happening behind the scenes than we realize? This topic creates a tremendous amount of insecurity because many men compare their own bodies to something they were never meant to use as a realistic standard. Let's talk about size because this is one of the biggest sources of unnecessary insecurity among men. The question is simple, but the emotions behind it are often complicated. Are adult film performers naturally that large, or is there something else happening behind the scenes? Many men quietly compare themselves to what they see online and start believing that they are somehow different or inadequate. But the reality is that adult entertainment does not represent the average male body. It represents a very carefully selected and edited version of reality. From a biological standpoint, the average erect penis length worldwide is around 5.4 inches. This number surprises many men because online content creates a completely different impression. The truth is that the vast majority of men fall within a normal range, and only a very small percentage are significantly above average. When you see performers in adult films, you are usually seeing individuals who were specifically selected because they already have uncommon physical characteristics. They are not a representation of what most men look like. But size is only one part of the story. The entertainment industry also uses many techniques that most viewers never consider. Camera angles can dramatically change how something appears on screen. Lighting, positioning, editing, and professional filming techniques can all create an image that looks very different from normal life. The same way movies use special effects to create unrealistic action scenes, adult entertainment often uses production methods to create a specific visual experience. There are also situations where performers may use temporary methods to enhance appearance or maintain performance during long filming sessions. Some may use devices, medications, or other medical interventions under professional supervision. These things are not visible to the viewer, which is why comparing yourself to what you see online can create an unfair and unrealistic expectation. Think about it this way. Comparing your body to an adult film performer is similar to comparing your weekend jog around the neighborhood to an Olympic athlete preparing for competition. You are comparing everyday reality to a highly selected and professionally optimized performance. It is not an accurate measurement of your worth, your masculinity, or your ability to have a satisfying relationship. One of the most important things I tell my patients is that real intimacy is not measured in inches. A healthy sexual relationship depends on many factors that have nothing to do with size. Confidence, communication, emotional connection, understanding your partner, and being comfortable with yourself often play a much greater role in satisfaction. Research and clinical experience repeatedly show that many partners value intimacy, attention, and emotional presence far more than the unrealistic measurements many men focus on. Yet, because of online comparisons, advertising, and misinformation, many men spend years worrying about something that was never actually a problem. If you find yourself comparing your body to what you see online, remind yourself of one simple truth. What you are watching is a performance. It is created for entertainment, not education. It is not a blueprint for what every man's body should look like, and it should never become the standard you use to judge yourself. Now let's move to the third question, which is another concern that brings many men into a urologist's office. Why does my urine sometimes spray, split, or change direction? Many men experience this and immediately worry that something serious is happening. The reason it creates so much concern is because urination is something we usually don't think about. It is a basic daily function. So when it suddenly changes, it can feel alarming. However, there are several clear explanations for why this happens. To understand it, imagine your urethra like a small tube that carries urine out of your body. Under normal circumstances, urine flows smoothly in one direction because the pathway is open and unobstructed. But if that pathway becomes temporarily blocked, narrowed, or affected by something inside the urethra, the stream can change. One common reason is leftover fluid after ejaculation. Sometimes small amounts of semen can remain inside the urethral opening, creating a temporary obstruction. When urine passes through, instead of coming out as one steady stream, it may split into different directions or spray. This can look strange, but if it happens occasionally and then returns to normal, it is usually not something dangerous. Another possible cause is irritation or inflammation. Conditions that affect the urinary tract can sometimes change the way urine flows. In older men, prostate enlargement can also play a role. As the prostate grows with age, it can place pressure on the urethra, making it harder for urine to pass smoothly. This may lead to changes such as a weaker stream, difficulty starting urination, stopping and starting during flow, or a feeling that the bladder has not completely emptied. The emotional effect of these symptoms should not be ignored either. Many men feel embarrassed when something as simple as urination becomes unpredictable. They may worry about making a mess, losing control, or having a problem they cannot explain. But I want you to understand that these changes are medical issues, not personal failures. Your body is simply communicating information, and learning how to interpret those signals is part of taking care of yourself. If your urine stream occasionally sprays after sexual activity and you have no other symptoms, there is usually no reason to panic. However, if the problem happens frequently or comes with additional symptoms, it deserves attention. A consistently weak stream needing to strain pain, burning, blood, and urine, or difficulty emptying your bladder should be discussed with a healthcare professional. A simple technique that can help some men manage occasional spraying is sitting down while urinating. This may feel unusual at first, especially in cultures where standing is considered the norm, but many men find that it improves control and reduces unwanted splashing. It is a practical solution that can make daily life easier. The main message is this: a split or spraying urine stream is often harmless, but persistent changes should not be ignored. Your urinary system gives you important clues about your health, and paying attention to those clues allows problems to be addressed early. Now that we have discussed erections, size concerns, and urinary changes, the next step is understanding what actions you should actually take. Knowing the information is important, but applying it to your own life is where real improvement begins. So after understanding these 3 common concerns, the next question becomes, what should you actually do with this information? Knowledge is valuable, but knowledge only creates change when you turn it into action. The goal is not to worry more about your body. The goal is to understand your body better, recognize warning signs when they appear, and make decisions that protect your health and confidence. If you are experiencing erections that disappear when you start overthinking, the first step is not to blame yourself. Instead, begin by finding out whether there is any physical cause behind the problem. A proper evaluation with a healthcare professional can help rule out conditions that may affect circulation, hormones, or other aspects of sexual function. Once medical causes are excluded, the focus should shift toward rebuilding confidence and breaking the anxiety pattern. This can involve different approaches depending on the individual. For some men, speaking with a therapist who understands sexual health can make a significant difference because it helps identify the thoughts and fears that create pressure during intimacy. For others, the solution may involve changing the way they approach sexual experiences, removing the pressure to perform perfectly and focusing more on connection, comfort, and communication can help the nervous system return to a relaxed state. Remember, intimacy is not a test that you pass or fail. It is an experience between two people, and confidence grows when you stop treating every moment as a performance evaluation. In certain situations, temporary medical assistance may also be helpful. Some men benefit from medications prescribed by their doctor, such as tadalafil, while they work on rebuilding confidence. These medications are not a magic solution, and they do not replace emotional connection or healthy habits. Their purpose is to provide support while the underlying issue is addressed. Now, when it comes to comparing yourself with adult film performers, the solution is often much simpler. Stop using entertainment as your measuring stick. Many men spend years feeling insecure because they compare their normal body to a carefully created image designed for entertainment purposes. Your value as a man is not determined by a measurement. Your ability to create a healthy relationship, communicate openly, care for your partner, and feel comfortable in your own body matters far more than unrealistic expectations created online. And if you are dealing with a urine stream that sprays or splits, the approach is similar. Do not immediately assume the worst. If it happens occasionally, especially after ejaculation, it may simply be caused by temporary changes in the urethra. However, if the problem becomes frequent or appears together with other urinary symptoms, that is when you should seek professional advice. For men over the age of 50, paying attention to prostate health becomes especially important. As men age, changes in the prostate can affect urinary flow and overall comfort. Regular checkups, healthy lifestyle choices, and early attention to symptoms can help prevent small issues from becoming larger problems. Many men wait too long because they feel embarrassed. They tell themselves that the problem is probably nothing or that they should simply ignore it. But your health should never be something you are ashamed to discuss. Urology is not about judgment. It is about understanding how your body works and finding solutions that improve your quality of life. This is why I always encourage men to take a proactive approach. Do not wait until a small concern becomes a major source of stress. Listen to your body, ask questions, seek reliable information. These simple steps can make a significant difference. There are also lifestyle factors that play an important role in men's health. Your cardiovascular health, your exercise habits, your diet, your sleep quality, and your stress levels all influence sexual function and urinary health. The body does not work in separate compartments. The same habits that protect your heart often support healthier erections and better overall performance. Maintaining a healthy weight, staying physically active, managing stress, avoiding excessive alcohol consumption, and getting enough sleep are all simple but powerful steps. These habits improve blood circulation, support hormone balance, and help your body function at its best. For men who are specifically concerned about prostate support, some people choose supplements containing ingredients that have been studied for urinary health. Certain natural compounds such as saw palmetto, pygeum, green tea extracts, and other plant-based ingredients have been researched for their possible role in supporting prostate comfort and healthy urinary function. However, it is important to remember that supplements should not replace medical evaluation, especially if you have persistent symptoms. Always discuss new supplements with a healthcare professional, especially if you take medications or have existing health conditions. The most effective approach to men's health is not a single product or quick fix. It is a combination of understanding your body, making healthy choices, and seeking proper care when needed. Let me also remind you of something that I believe every man needs to hear. Struggling with erections, worrying about size, or noticing changes in urination does not make you less of a man. These experiences are part of being human. Bodies change, stress affects us, health challenges happen. None of these things define your worth. The men who struggle the most are often the ones who keep everything hidden. They avoid asking questions, they avoid doctors, and they allow fear to grow in silence. But the moment you choose to learn and take action, you have already taken an important step toward improving your health. Your body is not your enemy. It is giving you information. The more you understand those signals, the better you can respond. In the final part, we will bring everything together and discuss the most important lessons from today's conversation, the mindset changes that can improve your confidence, and the simple actions you can start applying to protect your health at any age. As we come to the end of today's discussion, I want to leave you with one final message. Every question we covered today has one thing in common. Whether it's losing an erection because of anxiety, worrying that your body doesn't measure up to unrealistic standards, or noticing changes in your urine stream, none of these situations should be a source of shame. They should be seen as opportunities to better understand your health and take positive action before small concerns become bigger problems. If overthinking is affecting your erections, remember that this is a common experience for many men. Your mind and body work together, and when stress takes control, your sexual response can be affected. The encouraging news is that psychological erectile dysfunction is often highly reversible. Start by speaking with your doctor to rule out physical causes. Once you know your body is healthy, focus on rebuilding confidence, reducing anxiety, strengthening emotional connection, and following the treatment plan that is right for you. If you've spent years comparing yourself to adult film performers, it's time to let go of that unrealistic standard. What you see on screen is carefully selected, professionally produced entertainment, not an accurate reflection of normal life. Your confidence should never be based on comparisons with an industry that is designed to create fantasy. Real relationships are built on trust, communication, respect, and emotional connection. Those qualities will always matter more than unrealistic expectations about size. If your urine stream occasionally sprays or splits, don't immediately assume something is seriously wrong. Temporary changes can happen for harmless reasons. However, if the problem continues or is accompanied by pain, a weak stream, difficulty emptying your bladder, blood in the urine, or other urinary symptoms, don't ignore it. Schedule an appointment with a qualified urologist. Early evaluation often leads to simpler treatment and better long-term outcomes. For men over the age of 50, paying attention to prostate health becomes even more important. Regular medical checkups, staying physically active, maintaining a balanced diet, drinking enough water, managing stress, and getting quality sleep all contribute to healthier urinary function and better sexual health. Small habits practiced consistently often produce far greater results than searching for miracle solutions. I also want you to remember something that many men forget. Your health is not defined by a single moment, a single symptom, or a single difficult experience. Everyone's body changes with time. Hormones fluctuate, stress comes and goes. Life presents challenges that affect both physical and emotional well-being. Experiencing these changes does not mean you've failed. It simply means your body deserves attention, care, and understanding. The strongest men are not the ones who pretend nothing is wrong. They are the ones who ask questions, seek reliable medical advice, and take responsibility for their health before problems become more serious. Staying silent because of embarrassment only delays solutions. Seeking knowledge is a sign of strength, not weakness. So before we finish, let's quickly review the most important points we've discussed today.